Hi, my name is Kamryn Ford. Here is my paper, and I will be talking about the components of the integumentary system. Okay. So I think it's important to start with some common roles that the system has, which would be protecting the body from environmental hazards, synthesizing and storing lipids, as well as regulating body temperature. There are two main components, which are the cutaneous membrane, which holds the epidermis and dermis, and then the accessory structures, which contain things like hair follicles, nails, and exocrine glands. So the epidermis protects the dermis from any traumas. It synthesizes vitamin D3, and it also contains sensory receptors. There are 5 layers to the epidermis. The stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basal. And then under the epidermis is the dermis, which has a papillary layer that nourishes and supports the epidermis, as well as a reticular layer, which has a few jobs, some of those being restricting the spread of pathogens, attaching the skin to other important structures deeper in the layers, and it also helps with allowing for movement. The hypodermis is also known as the subcutaneous layer. It's usually not considered part of the integumentary system, but it does have a lot of very important roles. It stabilizes the position of the skin in relation to other tissues underneath the skin. It also stores fat. It is used as an energy reserve, and it absorbs shock from any traumas that the skin would have. And then a clinical application for this would be, as noted in the textbook, they talked about melanoma, which is the most dangerous form of skin cancer. It's also the most malignant, which makes it the most dangerous. So in a clinical setting, if you were working primarily with skin, I'm sure you would see a lot of different forms of cancer, not just melanoma. So understanding, like for instance, melanoma starts in the basal layer, I believe, of the epidermis, but obviously other cancers may or may not have similar structures and where they start. So I think understanding the different types of skin cancer would be an important clinical application for this purpose. So I think that should be everything. Thank you.